Good afternoon, everyone. Welcome to today's webinar hosted by Patagonia Health. Today's webinar topic is on integrating artificial intelligence into your health practice. If you aren't familiar with the Zoom webinar platform, take a look at the control panel at the bottom of your screen. Here you can configure your audio settings and ask questions if you have any. As a quick background about our speakers today, Aaron Davis is the director of the Center for Public Health Initiatives at Wichita State University. He applies business strategy and systems thinking to advance local public health efforts, including EHR implementation and informatics. Aaron supported the creation of public health AI guidance and co-leads AI trainings and a Kansas community of practice for Kansas LHDs. He was named a Du Beaumont Foundation 40 Under 40 leader. We're really excited to have him. We actually have another speaker today, Tatiana Y. Lin. She is a director of business strategy and innovation at the Kansas Health Institute, leading initiatives that strengthen public health through cross-sector partnerships and innovation. She specializes in health in all policies, AI in public health, and health impact assessments. Tatiana co-authored a national AI policy resource and co-leads an AI and public health community of practice for the National Network of Public Health Institutes. We are really excited to have them today, and obviously they are very accomplished. They have a lot of really good information today. So thank you so much for being here, guys. Without further ado, I will pass it over to you.
Well, good morning, everyone. We are both, Erin and I, excited to be here with you for the next hour. Thank you for making time in your busy schedule. We hope that this information will be helpful to you and your organizations. As we continue, please feel free to put your comments and questions in the chat. We have a little bit of a packed agenda, but we will try our best to get to your questions. And if we don't get to them, we will try to respond in writing, in the comments, or in the chat, or take them and provide them to Patagonia Health after the webinar. We also want to thank our host, Patagonia Health, for having us here today on this important topic. And so thank you for the introduction, for generous introduction. You can see my photo here as well. I'm very excited to be part of this webinar and just generally talking about how to advance AI in healthcare and public health. And we spent with Erin over the last 3 years of working on this topic. Just a few words to place in context the organization that I'm coming from. So I'm with the Kansas Health Institute. We are in Topeka, Kansas. So if you are in Midwest, please stop by to visit our offices. But our goal is really, we're a statewide organization. We do some project nationally, but our goal is really to improve the health of Kansans and contribute to the work moving forward as well across different policy areas. We're nonpartisan. We don't take a stance on the policy issues, but we work on a lot of different research topics. We work with communities close by, and we engaged in AI for the last 3 years.
Yeah, and I probably don't need to add anything else to what's already been said about me. So hi, Aaron Davis. I do see a couple of Kansas folks on the call today, so thank you for joining us. I think the one thing that I would throw in there is, I'd say systems disruption, and I think artificial intelligence is one of those things, and just figuring out ways that we can advance, especially the public health field when it comes to local government. So I work with the Community Engagement Institute at Wichita State. Basic thing to say about that is that we do anything that helps support community efforts. So we look to engage the community at all levels, all projects, all aspects. So thanks for letting us be here. I'll turn it back over to you, Tatiana.
Erin, so what did our AI journey look like? We feel like in order to help organizations across the country and in Kansas to be more comfortable with AI and how to proceed about their organizational policy development, we have developed a guide like AI policy guidance as a part of Public Health Infrastructure Grant. We're also working with partners to create and strengthen opportunities for policy landscape specific to public health. We created co-authored policy for American American Public Health Association, specifically focusing on workforce implications of AI. As Erin mentioned, we are working on community of practice here in Kansas and at the national level with a network of public health institutes. We hope that a lot of those lessons learned can be helpful and integrated in the work of others. We are testing different tools for public health functions. We are working with, even through those webinars, we are looking at the tools the communities are using and helping to share the one that we tested to share the information knowledge about those tools. And a part of our offerings are, of course, doing that, sharing the information and building capacity of our peer organizations. So just to give you kind of a snapshot in this map, as the last update was in May, so there were a couple fun activities we have done over June and July. But just to give you a sense of where we've been across the country, so we can see kind of coverage area between East and West Coast and Midwest as well. But what we really seen is, I think what another way to look at this map is we do see a lot of interest in the AI topic across organizations and a lot of appetite for the information. And so we really encourage you all the call to continue that peer networking and to help each other. If you develop the policy, to share it with your neighbors or others, and if you participate in the training, to share with others what you learned and how it can be helpful to other organizations. We also appreciate partnering with national partners as they continue to build that opportunities for local and county participation to share that information more widely. And so the guide that we have referenced, if you are in a process on your kind of journey or developing AI policy, we would recommend this guide that we have developed, and not just because we developed it, but we think it's actually a helpful resource. What you really find out about this guide is it does provide you with actual examples of provisions that we were able to find in policy review from other places and other states and counties, and really help you to say, oh, you don't have to start from scratch. Here's, if you're looking at the provisions to include then in data privacy section or transparency, here's some sample language that you can adapt, but also guides you to think through how do you get started to write new policy. So what things you need to maybe put in place in order to help you through the process to be smooth. And I want to recognize our partners from Health Resources in Action, who also contributed to developing that guide, and of course, Centers for Disease Control and Prevention funding through Public Health Infrastructure Grant. We'll just pause there for a second. I think Erin, you also put a link for this resource into the chat, but you also have a QR code. If you can grab a link, feel free to open your phone up and grab that QR code. Hope you will visit that resource. So what you can expect today from our conversations? We hope that once you stay with us for the next 55 minutes, you will have some new ideas of where you can apply artificial intelligence to in your daily tasks. You will think about, just be more equipped to tackle some considerations and key ethical considerations around use of AI. And then Erin is going to walk us through how to really create those effective prompts. So how do you really making sure that your outputs when you use the systems are as good as they can get? And to get there, this is kind of agenda that aligns with the objectives. We'll spend a little bit more time of setting the foundation for the conversations and then dive into a few examples from other counties. Maybe some of you on the call are from this county. So as we're walking through examples, please chime in about additional information for your colleagues. We'll also talk about what you need to consider before using AI tools, and also share some AI tools that we found helpful and kind of walk through the next steps. And yes, we'll have access to those slides and QR code after the presentation. Thank you for that question. So with that, we would like to kick off. We've been already talking to you for 9 minutes. So now we would like to hear from you in terms of participation in the poll. You can see on the screen a question: how comfortable are you with using AI tools in your work? And if number one choice is not comfortable at all, and the last one is very comfortable in using it, we'd like to get a sense from all of you, where are you thinking broadly about different AI tools that you're using in your workspace? So you have a QR code if you don't mind scanning that and answering that question, or there's also going to minty.com website and using the code on the top, 75963905.
I always like to test it, Tatiana. I went ahead and clicked it, and I'm not seeing the result popping up.
All right, let's make sure we can share the results.
There
I
we
seen
go.
them on. All right. Thanks for Mentimeter to cooperate with us. So as you can see here, we seen some results of the majority of you said curious but a little hesitant. If you answered curious but a little hesitant, we would love to hear from you. What is the hesitation? So what gives you pause on using it? It looks like a little bit slighter, closer. A second runner-up is comfortable but still learning, and so somewhat comfortable. And we have it 14% of people saying not comfortable and about 4 saying very comfortable. And so if you are on the other also side of that responses, if you're not comfortable at all, please tell us what gives you pause. Or if you're very comfortable, tell us what helped you get there. How did you get very comfortable to it? Please share with your peers. We would love to see that engagement in the chat. But I think it gives us a snapshot, and honestly, being in the other trainings and conversations, that's pretty much where everyone is at right now. Some of us are very curious and starting learning, and some of us are remain being uncomfortable. So tell us more where you are on that spectrum. So thank you for participating.
Yeah, and we could talk about what AI is, what's happening in the world of AI for hours and hours and hours. We're going to try to cram this down just to give you some high-level basics to make sure you can communicate a little bit more about what AI is and what is happening in the world. So one important thing to know is when we say artificial intelligence, that term means everything. So it's all of these different programs and aspects and technologies that act or simulate human intelligence. So that's all AI means, and there's lots of different types of systems that do that. You might hear the terms machine learning or deep learning. What that is a very specific type of AI that really allows computers to understand and process natural language and know and understand kind of everything that's happening around data aspects. So it's not just the old-fashioned understanding ones and zeros. It's a lot more complex and complicated than that, and really diving into how these machines can actually understand what's happening and react and respond to it. And once you think about kind of that technique being applied to artificial intelligence systems, then you have these really cool applications. And this is, of course, what all the buzz is about, is what we would call generative AI. This is where it not only knows and understands and responds to the aspects of what we're giving it as a prompt or what we're asking it to do, but it can actually, from that, in and of itself, create new content, whether that's text or images or sounds, all of those things that allow these AI systems to generate. So just some important terms to know. And with that, it's good to know that not all AI is the same. There's different risks and benefits in terms of how we use these systems and what the systems are designed for. So when we talk about AI, again, that's the broad brushstroke. So automating a couple of systems in terms of pulling out some data, you might need little human oversight, but other things would need a lot of human oversight, especially if we're talking about decision making. And those things we'll get into some of those details. But how we as organizations and sectors in the field of public health, for example, might apply AI, that can mean a lot of different things. So just good to know that when we talk about artificial intelligence, it's a big bucket, a broad spectrum of different types of technologies. And for those that might be a little on the cautious side of AI, that is totally understandable. And it's important to know that AI is not new. It's actually been around since the 1950s. A scientist named Alan Turing started an imitation test, also called the Turing test, where he was just judging and figuring out how to program a computer to where it would respond to the environment. From there, artificial intelligence actually gets coined in 1956. A lot happens between now and then. And what really has kicked off a lot of the conversations, we saw a lot of really fun things happening in the 90s around IBM Watson. But in 2020, a company called OpenAI launched, and that's what brought us ChatGPT. So when that launched in 2022, it kind of blew the doors off of artificial intelligence. Now we all have access to these systems, and it's kind of been going like wildfire ever since. So when we think about our hesitancy, this is what we'd call an AI literacy model. So for yourself as an individual and for your organization, one of the things that Tatiana and I are really passionate about is moving people up this model, making sure that you all understand what AI is, what the limitations are, what the opportunities are, getting you comfortable with using some of these systems because we're going to get more and more ingrained with AI systems. So the more we know and understand about them, we use them, we get comfortable with them, the more we're going to be able to look at their application and how we should be using them and if we want to use them and start answering some of those questions. So understanding AI is, of course, the first building block. We'll hopefully give you a little bit of that today, encourage you to use AI in some different ways. Then it moves up to the explore and integrate. So we move from using a system like Microsoft Copilot or ChatGPT to actually figuring out how we adopt AI solutions in an organizational strategist role. So getting them to help support our programs. And then if we can, we don't have to, of course, but for what organizations might want to move up to an adopt and scale AI organization wide, really thinking about meaningful opportunity and change in the organization. So we're going to start really with the bottom two sections today. I mentioned there's a lot going on in artificial intelligence. It's all over the news. I know I'm in get lots of newsletters about AI. Some important things to know and understand is what's happening at the federal, state, and local levels. So at the federal level, one of the things that was implemented in January, kind of a shift from the previous administration, what we saw was a document that was released called Removing Barriers to Artificial Intelligence. This was an executive order that outlined that basically when we think about the space race, the AI race, we want the US to be a leader in that. So with that, we have seen a few things trickle out from the federal level around advancing artificial intelligence for education and how we address that for youth. We've seen a couple of different things come out in terms of the federal government, again, not wanting to put barriers and limitations on AI. We have seen in May, just recently, the release of Make Our Children Healthy Again, that document which references AI. And we've seen a couple of elements around artificial intelligence in one big beautiful bill, the act that is in the process of going through Congress, where really one of the things there is, again, they want to release any barriers. So they want to make sure states can't limit certain companies and organizations on doing artificial intelligence activities. That was stripped out of the bill, but there's still a lot of conversation about what do we expect to be handed down from the federal level? So as of right now, while there are a few things, what we really encourage people to do is to pay attention to what's happening at the state level in your neck of the woods. So one great resource for that is NCSL. I think it's the National Council for State Legislators. I might have that wrong. Where we will take a look at what is happening in terms of what's being proposed, what's being passed that's AI related. They have a whole section for that. And just knowing and understanding, because right now a lot of laws are happening at the state level, what is it that will impact you, your organizations? And with that, what types of, oh, I got a new mouse and I'm sorry, it has all, if I touch the wheel, it goes crazy. There we go. When we think about all of the different laws that we're seeing passed, there's a lot around health use and a lot around government use. So the themes there are in the column. I won't read through every one, but to know that that we've seen over 150 bills analyzed around government use, which I know a lot of folks on the webinar today work in local or state government, as well as on the health side. So a lot of these things requiring clinician overview of outcomes. So making sure that that human in the loop, human oversight aspect is part of that. Making sure that any effects that AI might have on the workforce, that we know and understand what those are. We're transparent about those, especially when it comes to things that taxpayers fund. So again, just a good reminder to pay attention to what is happening in the field, specifically in your state, but also nationally, because it will impact everything we do around artificial intelligence, from the systems we don't even realize we're interacting with on our phones, to when we implement system-wide structures or softwares in our organizations, how those might be impacted. So keep an eye on those things.
Aaron. And so let's dive in a few examples from kind of public health space in the era of AI. So one way to also think about how it's relevant or how we can make it relevant to the work we're already doing, we believe that AI can really support our work on 10 essential services. And specifically, if you're thinking about the work under assessment, the question is how it can help us speed up the surveillance, how it can speed up the important work we're doing in forecasting, in analyzing the social determinants of health, of their impact, moving forward. We have seen that done for Centers Disease Control and Prevention, specifically to tuberculosis surveillance. They also exploring right now in using AI for opioid specific work. So there's some of that potential in the assessment space. In a policy development, AI can also be supportive or being used in quickly analyzing different policy elements. A specific example, we again seen that during the COVID-19 time when Centers for Disease Control and Prevention analyzed quickly using AI system to all the policies from different counties to understand what's going on in different parts of the country and to be able to respond to those needs. And then we are in other ways as well that we seen that AI was already being used to help identify, or in space of assurance, to identify and help support the workforce, some of the training specific to the workforce as well. And so as you're thinking about or continuing AI work, think about that 10 essential services and how it can provide kind of some foundation for your kind of AI work and with some of the cross-pollination there. So I would like to take it now from like a big picture national work to county level. And if you have somebody from Chicago Department of Public Health, we would love, to hear also in the chat your perspective on your work related to that. But this particular example is interesting one because it is in something that I know health departments are really working on is restaurant inspections. And it's an important area that requires resources. And so they developed a predictive model using AI and natural language processing to really efficiently do food safety inspections. And they had data for like historical data for over 11 years and reports. And though using AI system, they were able to analyze more than 92,000 free text statements, as well as you really took advantage of the generative component of AI because the system was able to analyze this common food safety violations, starting from like pest infestations to improper storage, and really point out where those particular locations in the restaurants that could be at higher risk, and in order to really allocate and target kind of those locations and resources to put them more effectively. One of the considerations around using that for using historical data and using AI for analyzing that, just keeping in mind on, how accurate the historical data were. Does that really reflect the existing kind of environment, as well as can there be any bias in the formal inspections? Because we know that, some neighborhoods could potentially be underrepresented, but overall that there has been a great article in APHA about highlighting how some of potential benefits of that approach and what the system was able to show. This is the snapshot that I found very interesting, how the data was analyzed and visualized. And on the left, again, this is kind of from publicly available resource. We have a citation here. On the left, you can see the world cloud that highlights common violation areas, that rear storage or preparation areas. And they were actually extracted using this visual text analysis. And they were, from the years of the data that the department had access to. And then there was a geospatial map plotting inspection. failures across Chicago, and that allows really the public health department to zoom into the hotspots and specific neighborhoods to see what the type of violations more likely to occur. So now moving on to a different type of examples of how chatbots can be used in AI. And we had some fun at the Kansas Health Institute to develop a chatbot that just focused on the document, on one document. And for us, it was just to see would our audiences interact with the chatbot and what kind of questions they had. So there is an opportunity actually to develop very cost effective to develop a chatbot. But of course, there are some parameters where it's important to ensure that it is properly functions and provides the information to the audience but there's some conditions you can set in order to make sure it's accurate. But in that particular example, the chatbot it's called Layla Got You. It's what's interesting about this chatbot for the health education purposes, that it was trained with the community input. So in order to develop the chatbot, engaged Black and Hispanic women to ensure that it is culturally resonates and it's effective. But the purpose of that was really to provide some sensitive information about family planning and being able to answer some questions about specifically to the needs of kind of sexual health information provided to the young women between the ages of 16 and 25. And so the chatbot received a good number of messages and had a lot of impressions. There were several interesting articles. If you go up there and take a look at that, again, Layla Got You chats. So it really shows the opportunity for using this AI technology for connecting with important audiences. And this is a visual what that chatbot looks like. It works 24/7 and answering some common questions and really reducing that burden between for public health communication for the public health staff to answer some common questions. And so the website also offers how to get involved and how to find additional care in addition to just having opportunity to answer the common questions. Right. And the next example would really show, and we just recently learned that about some use of the particular tool. There is a lot of need across the country for being able to provide information in different languages, and sometimes it's really hard to have all the languages and staff and all the opportunities, but it's really important. So I know several organizations have been experimenting with different tools, and they want to make a disclaimer that we put in the kind of Kansas here on the map, that the information here that we are sharing is to a best of our knowledge about the use of this tool in Johnson County, but also I believe in New York, in Niagara County, this tool is also being used for translation purposes or exploring for translation purposes. So the Pocket Talk is the tool that's been utilized and provides a real-time AI-based translation. What's interesting about this tool, it is HIPAA compliant. And so this tool also has high security and data privacy features, and so it allows to translate text in different languages in Niagara County, New York. This tool has been used a lot during the vaccination campaign and being able specifically during kind of big massive vaccinations where it was really important to being able to translate and work with individuals from different languages. And so if you are or your department is using a similar or different tool, would love to hear from you. Or if you are, using Pocket Talk specifically, would like to hear your, your experience with it as well. But that's something that to consider kind of AI leverage for those purposes. So we provided some examples from different counties from using their tools. We want to kind of wrap up the discussion with just sharing a couple additional strategies and a couple additional focused areas where you can consider leveraging AI. We spoke about policy and data analysis. Another ways to think about the areas of policy analysis is if you are thinking about the, summarizing policy or key points that you need for your discussion. It can, generative AI can do that, and Aaron will show us some effective prompts that could be leveraged. It can also be used to summarize literature. One particular tool that we had experience working with called Petal AI, and it just works within the documents that you provide, and it can analyze them through different dimensions. Of course, it's important to do quality assurance on that. And then writing and editing, I know a lot of us experimented with that, is simplifying the text in plain language, proofreading some of the language, providing some more effective narrative is another way you can think about using AI. There's some administrative functions, administrative support. We found it very helpful to use it for meeting minutes and summarizing those. Also organizing and drafting meeting agendas, and communication and engagement, for social media posts, suggesting hashtags, some serving as a sounding board for the ideas. As well, sometimes we want to, if we want to engage in a particular idea, you want to have an argument about it and have a well-developed argument, it can help you to be devil's advocate, to say what other folks might think about it or have a different perspective. So we talked about, as we talk about those examples, we'd like to hear from you. If you don't mind sharing, what task have you used AI for in your work? And let's make sure we have a QR code for you.
It looks like it
I'm on
disappeared.
it.
Okay.
So while we're waiting for QR code, you can also go to the website. I just put QR code in. So if I can show it there. So we would like to hear from you. What task you're using AI for? And I saw some conversation in the chat. I don't know, Erin, if you were have a minute to look at those messages in the chat, that there is something to bring up to their attention.
Yeah, it looks like we have a couple of folks that use Pocket Talk. There's a question about if LHDs are trusting medical translation. And I know we haven't talked to anyone specifically about that, so if anyone wants to chime in on the chat, that would be great. The comment about idea of using AI to help navigate opioid settlement funds, some opportunities there. Absolutely, there is. I think those were the biggest pieces. And then we did get a question, somebody wanting a little bit more information about the food safety tool. So we can maybe drop some links in the chat before we finish today.
Awesome, will do. Yes, if for Pocket Talk, I see there's some users as well on the call. So if you would like to share your perspective on the accuracy, what we heard from those who are using that, including those in Kansas, that there seem to be doing a pretty good job in terms of the accuracy. But of course, it's always good to take a look and verify with some of the kind of local experts. And we will post a link to the Chicago Department of Public Health work on specifically to the food inspections. I'll put in articles in the chat when Aaron will do his part of the presentation. All right, so what we see here in terms of the tasks, we can see here that there is a good number of you using that for kind of proofreading, making sense out of the documents, writing emails, social media also for kind of workflows. That's an interesting one as well. Minutes, reviewing plans, I assume providing feedback, quarterly reports, helping with those. And so, yeah, as you were talking about all of this, we would love if you chime in the chat about what benefits you're seeing. Is it about efficiency, accuracy, new ideas? What benefits are you seeing of using that, and maybe somewhat of pitfalls with that as well? All right, please continue to provide information as we move to the next section. So what do you need to consider before using AI in your work? So a couple things that we want to note here is that one of the things would be really important before you jump in and using AI is really have a clear rationale, as well as what are some ethical considerations to keep in mind and how you can do this effectively. So the first thing is about rationale. Why is it important? Because if we don't really know why we're using it, we might not use it correctly, or even might not be using it the most effective way. And not everything needs AI. So we need to really figure out where we need AI and for what purposes. And so how you go about that is really thinking about what problem you're trying to solve. Is there a different solution? What have you tried? Have the solution worked? Didn't work? So basically, do you need technology to help you with this solution? And if you need technology, is AI is the right technology? So having this brainstorming conversation with your team or with yourself, using for personal purposes, before you really jump into the conclusion if you need to use AI. And I like to do this, have this picture or photo about how AI can be the right or not the right solution. So if you're thinking about we want to wash our hands, and we can put that on the spout on the soap bar, and it probably a solution, but it's not the best solution, not going to get us where we're going. And so in that case, again, we just want to make sure that the AI solution aligns with what you're trying to solve. So let's talk a little bit about ethical considerations and what we need to keep in mind. And today we're going to just touch base on a couple. So there are several considerations around using AI. They range from bias mitigation, thinking about that AI systems can present biases because they're trained on the data, and the quality of the AI system is good as the data is in there and how the algorithm has been structured. And so, though that's important consideration, human oversight, we need this, we call human in the loop, to make sure we verifying AI outputs. There is importance of data privacy. We know that a lot of health departments and other organizations have sensitive data. So to make sure that we are, especially if you're using just publicly accessible systems, not something that our organizations procured and cleared, that you don't put, sensitive information in or sensitive data, you identified before the use, and you follow those kind of standards, unless it's been an approved tool to use by the IT department, and you're able to dive in and use the data in other ways. Transparency, how you're using data, is also important, or not data, sorry, the systems, so to make sure that it's stakeholders know that you're using the AI and for what purposes. And then a couple other ones, we can see the whole tension between should we only use AI if it's explainable. Sometimes AI is referred as a black box, so it's not quite clear how some decisions, how algorithms work. And so it's a worthwhile goal, but it's important to keep in mind is because it's not right now fully attainable for AI systems to be explainable, we need to make sure we understand when this explainability is critical. So if you're writing an email, we're not really maybe critical for us to know how AI wrote the email, but if you are using AI to determine eligibility for services, it's absolutely important to make sure that you clear how AI came up with those recommendations. And then lastly, there is environmental impact as well that's important to consider, because AI does take a lot of energy and resources. And bias mitigation, so biases, there are some biases in the system, and some of them are personal biases that you can bring to the AI, and Erin will show on the prompt side of things how to reduce those, but there is some already can be embedded into the system. So one thing that advises just to be cognizant of what biases exist, so you can spot those as you're using them and think about those, how to mitigate them. But some of them, again, goes back to if it's trained on the biased data, the outputs could have that bias present in kind of in the algorithm. But there is also can be interpretation bias. So if you put something in the system and it might not have the full context, it might not interpret it correctly. And then it can be human bias. So you, as well as you just bring personal biases when you ask a question or where you provide the outputs. And so having kind of an understanding again about this can help you move forward more effectively. So when you think about human oversight and human in the loop, it's really important. And you just maybe have seen an article that came from FDA about the use of system Ezra and how it was, the purpose of that system was to help speed up the kind of drug approval process. But there have been some limitations to the system about, what sometimes refers to hallucinations or just errors in the system, as well as confirmed relations, or there are some other terms, but basically meaning that AI sometimes can produce information that is not factual and correct. And so it's important to have human to detect errors, review the material, and making sure that the outputs are as good as they could be. And so one thing to think about it is within the risk system process, and that's something your organization can determine how much oversight you need at different levels. So there are some tasks that are just low risk. They don't need, huge oversight. A lot of people being involved. It can be just, lightly reviewed by the staff and maintain kind of original data how they used it. It could be like summarization of articles. It could be a low risk task, which could be just verified by the staff that involved in this process. Then you go into medium risk. Then you can be, it may be, for example, such tasks as prioritizing outreach. So which community can get outreach? In that cases, it is more medium risk because some community might not get outreach if you use AI for that prioritization. So in that case, it's really important to have human review more robust, maybe a rationale for accepting the outputs, spot check for bias, and have that process in place. And then we go into a high risk. So the one that I mentioned, eligibility decision, for example, for different services, or if you use an AI to decide which candidate is during the review process to be eligible for a interview or for joining the organization. In those particular cases, there's a mandatory human approval, multi-level review, sign of protocols, and kind of routine audits. And actually, some states put a legislation forward about not even allowing to use some of those systems for those particular purposes. So think about this, how much oversight you need based on the risk level that you're using AI for. And lastly, data privacy. Data privacy is really important. There's not really single one, regulation, how that mandates AI to disclose how they use or input data. And so again, you can have this kind of mental checklist in addition so before using AI, you can figure out what type of data you're using. Do you need to de-identify it? What system you're using? Is it kind of just genuine, available tool? So if it's available, just tool that you didn't procure through your organization, make sure that you de-identify the information, don't put any sensitive data in, even in the questions for AI, even if you're asking a question. And so also reviewing AI tools, privacy policy and data handling practices. And when using AI tools, you can do dummy data whenever possible. You can just generally do data minimization technique. You can disable data training. Some of the tools allowed to say, you cannot use my data for training. And then after using the AI tool, review kind of outputs and making sure that there is no just unintentional exposure, and document how the data been used. So in case you need to do audits, and then monitor changes to our platform privacy policies. So if there is a changes, you're attuned to that and making an appropriate plan of action. And with that, Erin will take us through the prompting.
Yeah, and going back to making sure that we're using these systems effectively. We do a lot in terms of generative AI. So those systems that a lot of us are used to in terms of ChatGPT, Microsoft Copilot, Gemini, Grok, Claude. There's lots of them. Especially for environmental purposes, when we use these systems, we might want to chat at them or prompt at them for a long period of time to get what we want. And as I think somebody mentioned in the chat, like sometimes it takes a while to get those. So the better we are at using these systems, the faster we can get the results we want, and the less we would have to use them in terms of energy use and those sorts of things. So when it comes to generative AI, I use the word prompt, and I think Tatiana did as well. If you're unfamiliar with that, that is basically the instructions or the action, the task that you give these systems to have it generate a response. So whether you're asking it for a joke or a riddle, or to develop a document, or to review an email, whatever you say into the system, that is your prompt. So I guess I should say one of the things that I like to talk about with prompting is if you go to a restaurant and you sit down and you say, "Feed me," you're going to get some weird looks. And if you're lucky, you might get some food, but you don't know what that's going to be. Could be good, could be bad. If you know what you want, you can actually order the specific thing, right? So a cheeseburger, medium well, lettuce, tomato, pickle, fries, all those things, and then you'll get what you want. So prompting is no different. And I would also advise you, if you don't quite know what you want, you can actually have a conversation with these systems to figure that out. So again, the better we are at prompting, the more we will get what we want out of it. And these systems are designed to be smart or sound smart. So we have to make sure that we're questioning the things that we are putting in and getting out of them. So it's okay to ask for clarification, seek reasons and causes as to why it responded the way it did, ask it to consider alternatives, challenge assumptions, ask it for sources and citations for what it's giving you, asking it if what it's providing is factual. So lots of different things that we need to get used to doing and understanding how these systems work. Some specific tips when you do submit a prompt, make sure that you are including relevant context. You're not getting too off the wall, but also providing it enough information to really get at what you want. And we'll show you some good examples of that. Tatiana mentioned bias. You can actually introduce bias in your prompts. So you want to make sure that your prompts are neutral and that you're going to get out kind of objective information. Make sure data privacy, HIPAA, public health is so good at that. Make sure that you are not putting sensitive personal information in those prompts, just like you wouldn't any other system. And making sure that you're refining your prompts based on the responses. Again, you're not just taking it for what it's worth, but you're diving a little bit deeper. And use structured frameworks. And if you don't know what that means, we'll show you in about 3 or 4 slides. So we want to make sure that you're including everything that you could possibly want in these prompts to get what you're after. When we talk about using the systems, and we saw a lot of great use cases on our word cloud, we categorize most things into assessing and analyzing, brainstorming, or creating. And these things are not completely separate from one another. You might be working on one project and do a little of all of them. But in general, when we talk about AI, the generative AI systems and how we use them, everything's going to fall into these 3 categories. So when we assess something, we could be asking it to review a draft of a new purchasing policy, critique the comprehensiveness, suggest any areas that might need more detail. What are the most common misconceptions about a topic and why might those be incorrect? So that's kind of the assessing, advising aspect of it. On brainstorming, which is my favorite thing, I could tell you all the crazy fun things I like to do in these systems, but what are some key terms that I should know about a topic? Make a list short and simple. Ask about creative ways you might serve a community for a placemaking project. You can have all these great brainstormings for projects. And then lastly, creating, whether it's something simple like an agenda or meeting notes. We do a lot of SMART objectives. So using that type of a framework to help you analyze those things, generating checklists. So there's a lot of really great things we can do in these systems. So when I mentioned formulas, again, there's a bunch of different formulas that we train on. We're just giving you a little bit today. I mentioned in the chat, we do a lot of different workshops on all these different subjects. So ethical, responsible use, prompt engineering, which is the art of crafting good prompts. So just to give you an idea of what we're talking about with this framework, APE, action, purpose, expectation. So if you're going to put something in the system, give it lots of detail, specifically what you're trying to achieve, the action you want it to do, the purpose, and the expectation, that desired outcome. And again, be specific. So one example of, instead of, write me an email, it could be write an email with a casual, professional, and friendly tone to a colleague. Good action, good context. Requesting their review of a newly created FAQ sheet on local health department billing procedures. So very specific in that purpose of what we're trying to achieve. And then the expectation, the email should be concise, express appreciation for their time, and include a clear request for specific feedback and by a set deadline. So all of those details will help you get what you want. Now, you may not ask the system to write all your emails, but that's a good example of what could be a very simple prompt, like feed me, into a more nuanced detail of exactly what you're after. And when we go through these formulas, we like to talk about audience, the length of what we're trying to get as an output, format, framing, constraints on if we have so many character limits, or if it's a specific audience, we might want to constrain it to. Priority areas, if you really want it to focus on a specific aspect, any assumptions you might have, and again, citations, asking for references. Those are always important, especially if we're pulling anything out of these systems we want to use for public consumption. So one of the reasons that we're really big on talking about artificial intelligence, especially in what we would call low risk administrative functions, so developing those policies, brainstorming on projects, doing some simple data review, it's because we know that there are opportunities for efficiencies. And I've actually, every couple of months, go back and look through all of these studies. What we have generally found through research is that most people who work on a computer or work with kind of routine tasks, we know that about 30% of their time is spent on tasks that could be automated or advanced with artificial intelligence. And of those, we think about there could be a 50% improvement or optimization of those activities. So we're not just talking about like replacing a task that somebody does, but also enhancing how we might build a presentation or go through the development of a document or review of something. So once we put those numbers together and think through about what does that mean for our individual workforce, that's when we can see that if we're using these systems ethically, responsibly, but successfully, then we could save about 6 hours a week per individual, which equates to about 300 hours per year. And I know I could always use more time in my day, so these systems can definitely help do that. Again, going back to what Tatiana started us off with, that responsible use, knowing why we're using these systems, how we're using them, making sure that we're not just throwing AI solutions at everything, but really identifying the key components that make sense to use and know that we can get some benefit out of them, making sure that we're not sacrificing quality in this process. One example of that is I will highlight one tool. We actually have workshops also where we highlight a lot of tools we know health departments are using, but Gamma is one of many tools that will actually build presentations for you. So in a scenario, this is the prompt, in a scenario where you might be doing a community health assessment, you've got to go give a presentation, and maybe this is all last minute. This is the scenario that I always dealt with when I worked at a health department of, we need this presentation made by tonight. So we know that we're going to be doing listening sessions, a community survey, a partner meeting, all these different aspects, and we want you to go present on it and get people excited about this community health assessment. So where I would start with this is going into ChatGPT, Microsoft Copilot, Claude, one of those systems, and tell it, hey, I need a prompt. I need your help thinking through the process. And I'm going to skip this video, but jump into ChatGPT, drop that prompt in there, tell it what you're trying to do. You need a prompt for this Gamma system, and you're doing this presentation. So when you go into Gamma, let me see if I can start this. What you see, this is one of those really interesting AI tools that's been developed. I dropped that prompt in there, which says we're creating a community-friendly presentation, explains the CHA and CHIP process. We want to include key engagement opportunities, listening sessions, surveys, partner meetings. We also want to make sure that we're emphasizing the benefits of participation, including decision-making, strengthening community assets, and shaping poly. I ran out of characters, but it knows we meant policies. So this specific system creates what's called a card, or these outlines of what it wants to cover. So you can edit these and change them before you hit generate. But these systems run this, the smart technology of generative AI in the background. It knows what you're after. It knows or it assumes, it takes guesses off what you've told it, and then it starts filling in the blanks. Now, this system, and this is live, this is how the system works. It will generate your entire PowerPoint in seconds and save you all that time. There are issues with this. We'll walk through that really quick. But the general thing to know is that starting from scratch, this might have just saved you 2 hours of trying to get something set up. Now you can change the backgrounds, the color, all of those things. You can also export it to PDF and then make your edits there, which is what I did in this case. So what that looks like, and this is the real PowerPoint that this system generated from me. It made up a title, Your Voice Matters, Shaping a Healthier Community. Maybe I like it, maybe I don't. Great picture. Was also AI generated that it slapped on there. We can go through, read it, edit things, add aspects to this. And I mentioned we need to be very careful as we use these systems, that human in the loop. You'll notice that could be water, but it almost looks like these people might be drinking wine. It creates some great visuals that maybe I wouldn't have done this in PowerPoint. We can go in and fill in dates, locations, those sorts of things. We can put in our QR code for our surveys. And then you'll notice they might be drinking wine again. Well, because this is a community aspect and it takes that word, it can go off on tangents. So we could have been more specific about what types of images that we wanted. So we wanted to use this as a good example of being very cautious and careful on how we use these systems and how much we're providing oversight into the things that they are generating for us. So again, a great PowerPoint, saved us a lot of time and energy, and there's still a lot of things that we need to tweak, and we could be getting better at the prompting, or it could be making sure that we have that human in the loop piece to this. So I know I've mentioned it a few times, we have a handful of different things that we like to go over. We're giving you just a little bit these different aspects. But when it comes to responsible ethical use, like that is a great place to start. And then knowing and understanding how to use these tools is the next step of making sure that we're doing that appropriately. So Tatiana?
Thanks, Aaron, and thanks for sticking with us. We put in the chat a few resources and it mentioned with the links, so you can explore that. And Aaron, I think there's, before I jump to the next step, there is a question for you. What tool is being used? Is it called Gamma AI? And is there anything that creates video content?
Yes, Gamma AI is the one that I just highlighted, and there are lots of video creation tools. And again, we're kind of in the forefront of this, so some of those video tools are not great. Canva AI, there's Sora, which is part of ChatGPT. Those are the two that I use, and I know that there's more. So, I mean, if you just do an internet search for video creation AI, there'll be a lot of tools at your disposal.
Thanks, Aaron. And to that question about the tools, one tool that I referenced that we found helpful is called Petal AI. And this one for the document review, it's just works within the documents itself. And so thinking about the next steps, I think, so a couple things to get started. Thinking with your team, what's the rationale for using AI and what we're problem trying to solve, then really thinking about specific areas you would like to utilize it for and what tools are available. I think you can start building AI literacy as you go. You're already doing that, joining the webinars. And honestly, I'm taking myself a class through Johns Hopkins as well to continue building, skill set and kind of peer networking. And so this AI literacy is really important. And it will help you to also build your AI policy because you need some literacy to build your AI policy. So use the guide. Hopefully you will find some use of the guide we have provided as well to do this work. And once ready, I mean, one thing we found helpful that having this peer group with your organization that just working together and figuring out what the next step, creating a plan for your organization, what AI roadmap looks like, figuring out what you're seeing, what are some benefits, what are shortcomings, how you can address those as you go. But different small use cases, even if it's document review, this can get you comfortable with some of those tools. We would like to wrap up with just sharing with you there is more AI support or workshops we are doing. This is kind of part of this introduction to AI. We also have specific more longer workshops on prompt engineering, kind of ins and outs. We have a AI policy development for organizations, just really how you get started, how you set up with your team, how you really develop different sections of AI policy, what are some considerations. And then we have a separate workshop on AI tools for different purposes. You can see here other ones for logic models, quality improvement, public health communications, and of course about the importance of AI, responsible use of AI, and ethical considerations. So all of that is also part of what our offerings. With that, I think we have about 3 minutes. So while we have 3 minutes, if you have a question, please feel free to put in the chat, unmute yourself. We also value your feedback. If you can screen that code and provide your feedback, if you just, right now over that, or if you have time later, just keep it open in your desk. We would appreciate anything we can learn from your feedback. And also communicate what your priorities are and if there's anything we can support you with. But with that, any questions that Aaron and I can answer? Aaron, if you want to keep that QR code just for a couple more minutes.
Sorry. Yep, you are correct. Sorry. Yeah, to the question from Mindy, if one of the things we're realizing as we talk to folks across the country is a lot of folks can't use AI. They're restricted by their organization, municipality, IT, county, like whatever might be kind of oversight for them. If there are folks that we can talk to, we are happy to do so. But we're happy to present. We've presented to cities and counties before.
Awesome. Yeah, and thank Hope for mentioning the Johns Hopkins course. I'm at the beginning of that since it's grown great, so appreciate it. I will be able to provide, additional insights once I go through it. It's another 9 weeks. Glad others enjoying that. It says here that there's some challenges with copy and pasting the links. We'll make sure we provide it with the slides, so you'll have those links as well.
I might have to ask Patagonia to help with that. So
Any
Yes,
other
we can do
comments or
that.
questions? Awesome. Well, thank you for being an awesome audience, for engaging with us and spending some time. We hope to connect in the future. And so thank you and have fantastic the rest of the week and the weekend.
Thank you so much, Erin and Tatiana, for that great presentation. We really appreciate it. This has been really awesome. And if anybody on the call is not yet using Patagonia Health and has any questions about us and what we do, we are an integrated EHR practice management and billing solution specifically designed for public and behavioral health organizations. All right, have a great day, everybody. Thank you.